Some drivers show up to their DOT physical ready to go and then find out they need extra paperwork they didn't know about. That one surprise can push your certification back days, sometimes longer. So let's talk about which medical conditions trigger additional forms and how to walk in prepared. The FMCSA doesn't just want to know that you have a condition. They want to know it's under control. That's why certain diagnoses require supporting documentation from your treating providers before an examiner can certify you. It's not about catching you out. It's about confirming your condition is managed well enough that you can safely operate a commercial vehicle. Sleep apnea is one of the most common ones. If you've been diagnosed with obstructive sleep apnea and you're using a CPAP machine, you'll need to show a compliance report. That means at least 4 hours of use per night on at least 70% of nights. You'll also want your sleep study results and a letter from your sleep specialist. If you use insulin to manage diabetes, there's a specific FMCSA form called the MCSA 5870, the Insulin-Treated Diabetes Mellitus Assessment Form. Your treating clinician fills that out. You'll also need recent A1C results and your current medication list. For cardiovascular conditions, things like a prior heart attack, a stent, or bypass surgery, your examiner will want a clearance letter from your cardiologist, along with recent test results like a stress test or echocardiogram, and your current medications. Seizure history is another area that requires documentation. You'll typically need a neurologist evaluation, records showing how long you've been seizure-free, and documentation of medication compliance. The seizure-free timeframe matters a lot here, so make sure your neurologist is prepared to speak to that specifically. High blood pressure can also require extra steps. If your readings are elevated, or you're managing it with medication, bring recent blood pressure logs and a letter from your primary care provider confirming it's under control. The pattern across all of these is the same. Your examiner needs to see that the condition is being monitored and managed, not just that it exists. So here's the practical takeaway. Before your appointment, make a list of every ongoing medical condition you're being treated for. Then think about whether any of them fall into these categories. If they do, reach out to your treating providers ahead of time and request the relevant documentation. Clearance letters, recent lab work, test results, medication lists. Don't wait until the morning of your exam to track these down. Coming in prepared doesn't just save time. It's often the difference between walking out with your medical card and having to reschedule.